Thanks for joining me. Today we're going to discuss shoulder replacement surgery. Now, almost everyone knows someone who's been through hip or knee replacement surgery, right? Those are very common surgeries in America today. Maybe you yourself have been through one of those. It turns out, though, that shoulder replacement surgery has been around just as long and has just as great of outcomes. It's just a little less common. And so this video is going to discuss some of the unknowns and mysteries around shoulder replacement surgery, what the surgery is like, what the ultimate outcome is like. If you have questions about shoulder replacement surgery, stay tuned. Welcome back. I'm Dr. Dan Tomaszewski, orthopedic surgeon at the Dorr Orthopedic Center at Dorr County Medical Center. And again, today, as promised, we're going to discuss shoulder replacement surgery. And I think any discussion of shoulder replacement surgery deserves just a little bit of time spent on the history of shoulder replacement. Now, your shoulder right now is a ball and socket joint. And originally, when shoulder replacement surgery was developed, it was developed in what we would call an anatomic fashion, replacing the ball with a new metal ball and replacing the socket with a new plastic socket, such that it was anatomic. It was just like you. And that shoulder surgery worked great for people with severe arthritis. But there were some limitations. That surgery involved cutting one of the rotator cuff muscles to put the parts in, to exchange your old ball and socket for a new ball and socket. And when we were done with that surgery, you'd have to repair that muscle. And you'd have to, after surgery, immobilize the shoulder to make sure that that healed well. If you didn't immobilize the shoulder, well, those stitches could all pop out and the shoulder wouldn't work well. Additionally, you may know that the rotator cuff can wear and tear over the course of time. And so 5 years down the road, 20 years down the road, if you developed a rotator cuff tear, well, that shoulder wouldn't work well for you anymore. And so there were lots of things that could be improved upon. The results were great for the vast majority of people, but the recovery was kind of long, and there were some things that could happen that could limit your ultimate result. And over time, just like every other surgery and every other technology, things have evolved, and shoulder replacement surgery is a great example of that. Today, shoulder replacement surgery is done much differently. Today, in America, the vast majority of shoulder replacements are done in what we would call a reversed fashion, putting a ball where the socket was and a socket where the ball was, so that the articulation, so that the joint is reversed. And that has some great benefits. That change, reversing the ball and socket, made it so that your shoulder wouldn't need a rotator cuff to work properly. In fact, that shoulder replacement was designed specifically for people who didn't have a rotator cuff. And so it was a really great tool to help people with a really terrible problem of an irreparable rotator cuff tear. Well, it turns out that that shoulder works really well for people even who have a good rotator cuff. It just doesn't require the rotator cuff. And because of that, we don't have to worry about, say, repairing that muscle in the front of the shoulder. You can use your shoulder right away because it works great with or without that muscle. And long term, if you develop a tear in your rotator cuff for whatever reason down the road, it doesn't matter. The shoulder works great with or without a rotator cuff. And so there's some really great benefits to this technology. Now, today in my practice, about 95% of patients who need a shoulder replacement get a reverse shoulder replacement. There's still a role for anatomic shoulder replacements, but those are much less common. Chances are, if you're seeing me for a shoulder replacement, you're getting a reverse shoulder replacement. Now, what about the surgery itself? Now, commonly, that surgery is done in a relatively minimally invasive fashion. Typically an incision of about 4 inches or so for the average sized person, to take out the old parts and put the new parts in. And fortunately, that surgery can be done many times with a regional anesthesia and some sedation. So we don't have to give you really heavy general anesthesia that's going to make you groggy and sick and hungover. It can be a really kind of a quick process, a quick recovery, such that the majority of patients can actually be done well and safely and comfortably in an outpatient fashion. You actually can go home relatively comfortably after the surgery. Additionally, I talked about with original shoulder replacement surgery, we had to immobilize the arm for a period of time to protect that muscle. Well, we don't have to worry about that now. Today we just give people a sling, and it's just for comfort. I tell you, you probably should wear it for the first 10 days or so, by and large, just to keep it comfortable, to keep the swelling down. But you don't need to wear it out of hand. You don't need to wear it because we have to protect something. In fact, we like you to use your arm sooner rather than later. The sooner that you use the arm, the quicker you get your muscles back, the quicker you get your mobility back. And so those have been really great benefits of reverse shoulder replacement. Now, many people will ask me, what's life like after shoulder replacement surgery? Am I going to be able to throw a football or play tennis or do other physical activities? Well, I like to talk about the results in terms of both restrictions and limitations. And those are two different things. And let me explain. Restrictions are things that I put on you. I say, don't do that or you're going to get in trouble. Now, initially, after surgery, we have really one restriction. That is, I don't like you to push off with your arm, like on the arm of a chair, pushing yourself up for about 6 weeks after surgery, because that can cause your shoulder to be unstable. We don't want to do that for about 6 weeks. But after that, you can really use your shoulder to the degree that you want to. You can lift and pull, you can be active, you can play tennis, you can play pickleball, you could cut firewood, you can be as active as you want. But realize the more active you are, the more you do with this, the more wear and tear you get in your shoulder. Your shoulder wore out. Your shoulder had problems, and we replaced this with metal and plastic. Metal and plastic is no different, of course. It can wear out too, and so you have to be a little bit mindful of that. You want to regain your physical activity, your quality of life, but you also don't want to be having to go through the surgery again because things wore out. So you have to really balance things out a bit. Now, from a functional standpoint, most people can do routine activities of life. You can get dressed, you can put dishes away in the cupboard, you can use your arm for simple activities. But there are some limitations, some things that you really just, many people can't do after surgery. And the most common one is that it's really hard to get your arm around your back after surgery. I tell people you can expect to be able to get to your back pocket, maybe to pull your wallet out, but tucking your shirt in behind your back and certainly clasping a bra strap behind your back, those are very difficult activities to do after a shoulder replacement surgery, even under the best of circumstances. Now, I do have some people that can do that, but you can't count on being able to do those things after surgery. And so if that is a limiting factor for you, if you say, you know what, I don't want to consider living my life where I can't, clasp a bra strap behind my back, well then maybe this surgery isn't for you. You have to consider that before surgery because that may be a limitation with the surgery itself. Now, after surgery, we typically see people about 10 to 14 days later just to check the wound, make sure things are healed well. Again, expect it to be very bruised and swollen still at that stage. But at that point, we can really start weaning away from the sling by and large to use the arm for routine activities. After surgery, we typically give people blood thinners for about 6 weeks, and usually that's just a baby aspirin, but if you have a higher risk for blood clots or if you were on blood thinners before surgery, you might be on something different. But we do use a blood thinner of some sort for about 6 weeks after surgery. Now, ultimately, shoulder replacement surgery is a great tool for people with really terrible problems around the shoulder. It can address issues of irreparable rotator cuff tears, severe arthritis, even in some circumstances, fractures around the shoulder. No surgery is perfect. There are risks and complications, and there's a recovery that you have to be willing and able to go through. But for people with really disabling problems around the shoulder, it can be a tremendous benefit, just the same as a hip or a knee replacement can. Now, this video is intended to be sort of a primer of shoulder replacement surgery, what that surgery is like, what the recovery is like, what the rehab is like. But we have a whole class dedicated to teaching people who are going through shoulder replacement what the fine details are, what to expect all along the way. But if you have any questions about shoulder replacement surgery, what the surgery is like, what the recovery is like, am I a candidate for shoulder replacement surgery, we always love hearing from you. Don't ever hesitate to contact us. That's what we're here for. But again, thanks for watching, and we'll see you soon.